It's Christmas Day, about 20 minutes before noon. A medevac helicopter just landed on the roof of UCSD's medical center in Hillcrest, a patient in tow. But otherwise, it's been a quiet morning. Inside, the emergency room is deserted. A few blocks away, the scene is very much the same at Scripps Mercy Hospital. A woman, wearing a patient gown, asks me for a light. When I tell her I don't smoke, she seems disappointed. But there are a few other souls here. Most are, fortunately, spending Christmas morning with their families, not in the hospital. The question on the minds of the region's hospital operators is what Christmas in 25 years will be like. Ever since UCSD announced its, quote, vision for the future, unquote, 2 years ago, a plan calling for transforming Hillcrest Hospital into a standalone emergency room by 2030 and moving most inpatient services to the university's Thornton Hospital in La Jolla, few have agreed on the answer. Driven by the state's seismic retrofit mandate for hospitals, UCSD says it will build the medical center of the future in La Jolla, one offering the most innovative and state-of-the-art procedures. Because it would cost more to retrofit Hillcrest than to expand Thornton, and because a majority of its patients live in the north, the university argues it makes more sense to build its hospital where the people are. Critics, however, counter that the university is running to the suburbs and shirking its responsibility to treat the downtown core's ranks of indigent and uninsured. One opponent of the university's plan is Scripps Health Chief Medical Officer, Brent Eastwood. Dr. Eastwood says UCSD's current patients, especially its poorest and most vulnerable, will likely not follow the university north and instead go to another health provider in the area. That, he fears, will overwhelm hospitals in Central and South San Diego. His company's Mercy Hospital and Mercy Hospital Chula Vista have already lost $20 million over the past 5 years because of the cost of treating the area's and underinsured. Worried that UCSD's move will threaten the safety net, the government-funded healthcare of last resort, San Diego County's Board of Supervisors hired a private consultant to evaluate the county's healthcare future. The consultant's report, accepted by the supervisors in December, found that, quote, UCSD Medical Center's announced inpatient move will impact some patients and their families. However, the impact is expected to be minimized by UCSD Medical Center's plans to leave outpatient capacity at Hillcrest. The university has promised to provide shuttle services between Thornton and Hillcrest for those who may not have the resources or transportation to get to La Jolla. However, even the university admits that for a small number of patients, negligible it says, the 13-mile trip will prove unworkable. Dr. Eastman worries that it would prove fatal. Much of the debate surrounding the planned move is whether a potentially fatal inconvenience for a small number of patients should stand in the way of improved health care for the great many, especially if those select few are significantly worse off economically than the many who benefit. Then there's one other major hurdle. It is currently illegal in California to operate emergency rooms that are not connected to a hospital. The university is betting that the law will change by 2030. There are a few states that allow standalone emergency rooms, though usually for rural areas lacking the population to justify full hospitals. Critics say Hillcrest will be the first time a major urban hospital is replaced by a standalone emergency room. UCSD's plans come at an unusual time for the healthcare industry. On one hand, it is experiencing its largest hospital construction boom in decades. But on the other, most of that construction is in rural and suburban areas, and public hospitals are closing at an alarming rate. In San Diego, 4 other major hospitals have closed down or significantly reduced their services over the last decade. Owners of 2 more have put them on the block in recent months, and UCSD's medical center remains one of few central hospitals that continues to actually make money. In some ways, both sides agree, the debate is a symptom of a bigger problem, a dearth of public funds to pay for healthcare in San Diego, even as the numbers of uninsured continue to grow. The county ranks 5th from the bottom in the state for spending per uninsured. Then there's the problem with the federal government. Under the formulas used to compensate healthcare providers for their services to Medicare patients, San Diego hospitals are paid at the same rate as those in rural counties, one of the lowest in the state. We are in a diabolical situation where we're paid as though we're a rural community, says Dr. Eastman. And we're going to wake up in San Diego one day and we're not going to have doctors or any hospitals, because no one is going to be able to keep their door open. For the past 2 years, operators of major San Diego hospitals have been locked in a bitter dispute about their visions for the future of healthcare in the region. It's a debate that foreshadows choices the county and the rest of the country will be forced to make, as rapid technological innovation and population shifts further expose the deep divisions between the growing ranks of those who lack adequate medical care and those who have it.